What is GERD or acid reflux?
This is a very common symptom which is called GERD. It means acid reflux, sour taste in the inner mouth, and there is heartburn, that is burning sensation from neck to the chest or upper abdomen.
How common is it?
It is quite common. Even in our day-to-day practice, we get that it is more common than the current data. The current data says in India, acid reflux is around 10%. 10% of common people suffer acid reflux. But what we generally see in our day-to-day practice that much more patients are coming with acid reflux symptoms than other disorders.
Sir, for all, will you please elaborate on the symptomatology?
Yes, as we said, one is reflux or coming sour taste, coming up the gastric content which comes up into our oral cavity, and second is heartburn, and also there may be chest pain, and as we said that there are other symptoms also which is not related to reflux per se but may be associated somehow like chest symptoms. These are mainly chest symptoms like cough, wheezing or asthma. It has been seen that people who are suffering more commonly from asthma or this chronic cough or cough for longer duration generally have acid reflux. First of all, we suggest
Hello everyone, good morning, and I'm Dr. Riya Shah, MD Medicine Physician, and we have with us Dr. Krishanu Boni, Gold Medalist being Gastroenterologist. And today we have come with a topic for podcast which is a very common question for all of you. It's about acid reflux and the symptoms associated with it. So today our topic is GERD or Gastroesophageal Reflux Disease, or commonly called as acid reflux by all. So we will be answering all your common questions and discussing on it. So coming to a podcast. Hello sir. Good morning. So coming to a podcast, and first question will be, what is GERD or acid reflux?
this is a very common symptom which is called GERD. It means acid reflux, sour taste in the in our mouth, and there is heartburn, that is burning sensation from neck to the chest or upper abdomen. So these are the cardinal symptoms of acid reflux. There are some other symptoms also like cough, asthma, which is unrelated to gastrointestinal tract, but these symptom constellation are called acid reflux.
So how common is it?
It is quite common. Even in our day-to-day practice, we get that it is more common than the current data. The current data says in India, acid reflux is around 10%. People, 10% of common people suffer acid reflux. But what we generally see in our day-to-day practice that much more patients are coming with acid reflux symptoms than other disorders. And I would like to ask you, how commonly do you get acid reflux?
Very common. Every other patient almost, if even the patient is coming with a different problem, he or she will be having almost half of my
Yes.
patients, they are complaining of
Acid
acid
reflux.
reflux.
So this is a very common symptom per se, and also it is the most probably the most common associated symptom.
Sir, for all, will you please elaborate on the symptomatology?
Yes, as we said, one is reflux or coming sour taste, coming up the gastric content which comes up into our oral cavity, and second is heartburn, and also there may be chest pain, and as we said that there are other symptoms also which is not related to reflux per se but may be associated somehow like chest symptoms. These are mainly chest symptoms like cough, wheezing or asthma. It has been seen that people who are suffering more commonly from asthma or this chronic cough or cough for longer duration generally have acid reflux. So these are the symptomatology, and it is more prevalent in some group of people like those who are obese. So obesity is a common association with acid reflux, and those are taking polymedicines. Some people are taking number of medicines for number of their ailments. So polypharmacy is associated with acid reflux, and people who are suffering from some chronic disorders like kidney disease or liver disease, diabetes, these people are also uh, more prone to develop this reflux
That's
symptoms.
why people, apart from people who are solely suffering from GERD,
Yes,
we get so many other patients suffering from other comorbidities present in GERD.
yes. So acid reflux is one of the most common associated symptoms in clinics.
So, how do we initially diagnose it?
Look, initial diagnosis is not very difficult or test intensive. These typical symptoms of acid reflux, heartburn, and chest pain, we diagnose acid reflux on clinical basis. And one mode of diagnosis is empirical PPI therapy. PPI like omeprazole, pantoprazole group of drugs. These medicines are the first line treatment for GERD or acid reflux disorders. So, an empirical PPI therapy for 8 weeks, 8 to 12 weeks, if the patient responds to these, we call it GERD. And there are some other modalities also, and these things come next if patient is not responding properly to these medicines.
So, for GERD, what are some home remedies that patients can take up to get
Yes,
some initial cure?
yes. First of all, we suggest the lifestyle modification and dietary modification. Those who are obese must work on their weight, to reduce their weight, because the central obesity, the abdominal fat content, is one of the most important contributory factors for acid reflux. So, first and foremost is weight reduction. Second is to avoid alcohol and smoking, which are also very important causes of acid reflux. Thirdly, to avoid junk foods and sweets, uh, beverages containing caffeine. Those who indulge more in taking tea or coffee for multiple times a day, they are also predisposed to acid reflux more frequently. So, curtailing tea or coffee and chocolate containing foods, fast foods, avoiding alcohol, smoking, reducing body weight, these are the uh, main dietary modifications. And if people are still getting acid reflux symptoms, then we suggest to raise their head end of their bed during lying down or during sleep, particularly during night, and taking small amount and frequent meals, not to keep their stomach completely empty for a longer time, and also not to take larger meals at once. So, to summarize, avoiding smoking and alcohol, reduction of body weight, reducing the abdominal fat content, and curtailing tea, coffee, junk food, sweeteners, raising the head end of bed. These are the home remedies which can relieve much symptoms of acid reflux.
Apart from these home remedies, what are the pharmacological and medical treatments, initial medical treatments that a patient may need?
So initially, when patients come with acid reflux, we prescribe them these home remedies, and along with that, we prescribe them some PPI group of medicines or PCAB group of medicines. These are pantoprazole, omeprazole, lansoprazole, rabeprazole group of drugs, or vonoprazole group of drugs. So we generally prescribe these medicines for a span of 8 to 12 weeks, 2 to 3 months. So this is the initial and nearly universal treatment for acid reflux when the patient comes for the first time.
And when a patient is not responding despite medical treatment, what are the modalities that we take upon?
There may be number of factors or number of causes when a patient is not responding to these primary medicines. Then we look up for other causes or some deeper causes, like there may be a problem with medicine adherence. Patient may not be uh, properly taking the medications prescribed, or there may be infrequent or inadequate dosage. There may be some acid reflux related complications, like stricture formation, narrowing of the esophagus or food pipe, and there is a condition which is called Barrett's esophagus, which is a pre-malignant condition where a pinkish stomach mucosa replaces the pale esophageal mucosa at its lower end. So it can hamper the effectiveness of medicine. Also, patients who are developing malignancy or carcinoma due to long-term Barrett's esophagus or acid reflux may not be relieved properly with medicines. So these are factors related to reflux, and there are some unrelated causes which should be sought, like a condition called eosinophilic esophagitis. This is an allergic disease of the esophagus or food pipe, which is increasing its prevalence in countries like India. It was once thought to be a disease of Western countries, but nowadays it is also increasing its prevalence in India. So, eosinophilic esophagitis. There are some abnormalities of esophageal motility or movement, which is termed as achalasia, and there may be infection of esophagus, infective causes. Some medicines can lead to ulceration of esophagus or food pipe, like iron supplement, bisphosphonates, or painkillers, NSAID group of drugs. So, infective disorders, pill-induced esophagitis, cancer, eosinophilic esophagitis, achalasia cardia. These are the unrelated causes for persistent acid reflux. So once the patient is not responding to the primary therapies for acid reflux, besides these lifestyle and dietary modifications, then we look up for these causes. And there are certain modalities to look for that.
What are the common tests you are going to do?
After a period of PPI trial for 8 to 12 weeks, we generally prescribe upper GI endoscopy or gastroscopy, which is the first and foremost test for acid reflux in non-responding patients. And in some cases, if we see an abnormality in the esophagus or a food pipe, then we take biopsy and do a histopathological examination. Second thing is we can measure how much acid is refluxing by means of pH monitoring impedance testing of esophagus. And thirdly, if the patient is not responding to medicines and we are thinking to suggest him some endoscopic or surgical therapy besides medicine, then we go for esophageal manometry, which can detect these motility disorders, abnormality of esophageal movement, abnormality of the movement of our upper GI tract, and there are some associated gastric dysmotility. Our stomach generally empties the food we take within a span of 4 to 6 hours, but in patients, especially those who are suffering from diabetes and some other neurological disorders like Parkinson's disease or multiple sclerosis, those who are suffering from chronic kidney disease or renal failure, so these patients are very much prone to gastric dysmotility, and it contributes to persistent acid reflux. Then we also test for gastric dysmotility or gastric emptying studies. So upper GI endoscopy or gastroscopy, esophageal pH and impedance testing, esophageal manometry, and gastric emptying studies. These are the front liner tests to detect non-responding acid reflux.
So once we have diagnosed the causes or the effects of GERD, What are the other modes of treatment apart from the medical treatments that we can use to cure these patients who have developed complications uh,
In
or
uncomplicated,
refractory?
yes, in uncomplicated and refractory GERD, suppose there is, we have done all these tests or some of these tests and we do not find or suspect any complication or any other associated disorder, then we increase the dose of primary medicines. This PPI can be increased. We can give double dose PPI, one before breakfast and one at bedtime at night. And there are other groups of medicines also, like H2 receptor blockers like ranitidine, famotidine. It has been seen that the nocturnal symptoms or nighttime symptoms are mostly related to a chemical which is called histamine. So this ranitidine and famotidine group of drugs, medicines block histamine release at night. So it has been seen that 60 to 70% patients, when we prescribe an add-on H2 receptor blocker like ranitidine at night, they respond to these treatments. Another medicine is called alginate syrup. It is found in gel formulation, and it floats above the stomach content, and it covers the small acid pockets which are formed within our food pipe, and they can relieve symptoms. And as we told previously that vonoprazan, or this is a new class of drug, PCAB, it is called PCAB. So it is also very effective for treating refractory GERD. So these are the medical therapy for refractory GERD.
What are some endoscopic or surgical managements which we can take up in GERD patients not responding to adequate and optimum medical care?
Now, after optimal medical therapy of refractory GERD comes the endoscopic treatment. This is the second line of treatment nowadays. There is a mechanism called lower esophageal sphincter, or we commonly know it or call it as Elias. Yes. The tonicity of Elias prevents reflux. Now, when the Elias becomes much relaxed, it precipitates more reflux. So these endoscopic therapies are mainly aimed at increasing or restoring the tone of this Elias by means of, there are some modalities called anti-reflux mucosal interventions, or ARMI. In acronym it is called ARMI. And this Elias mucosa can be ablated by radiofrequency, or this is called radiofrequency ablation, or this mucosa can be resected endoscopically, which is known as anti-reflux mucosectomy, or we can use rubber bands, which we use generally in patients with variceal bleeding, that EVL bands. I think most of us have heard the name of EVL. So now these EVL bands can also be are being used actually for endoscopic management of acid reflux, and these are very effective. As of the initial data we are getting, it is effective more than 90% patients at 1 year duration. So once these endoscopic treatments are done, patients are symptom free. Most of the patients are symptom free for at least 1 year. This data we have got, but we are awaiting for longer duration data.
Are there any scope for surgical management?
Yes, there are also scope for surgical management, and these surgical treatments come after endoscopic therapy. Those who are not responding to even endoscopic therapy, or there are some complications, especially there is Barrett's esophagus associated with some nodularity or tumor mass formation, or there is stricture formation. There is permanent narrowing of the gastroesophageal junction. So in those cases, we can approach for surgery. But it has been seen that medical therapy, proper lifestyle, dietary management with medical therapy and endoscopic management can relieve or even cure GERD for more than 95% patients.
So for maximum of the patients, they need to focus on lifestyle modification first,
Yes.
followed by medical management, and then we can
I
go.
think I think more than 70% patients can relieve their GERD symptoms by following these home remedies that we discussed.
And if there is no relief, then the patient should always come to a doctor
Yes.
for further
Yes.
management and
In this
evaluation.
context, we must discuss when we should seek medical therapy. When should we seek medical attention? There are some red flag signs which are called dangerous signs or symptoms of GERD. If there is persistent vomiting, along with acid reflux, there is vomiting, or there is pain in abdomen, there is weight loss, or there is vomiting of blood or black colored stool. These are the difficulty in swallowing food, which is called dysphagia. So these are the alarm features when one must not delay the medical attention.
So thank you, sir, for such a good discussion.
Thank you.
I hope a lot of doubts have been cleared in this discussion. Such a common problem.
Yes, very common.
So,
Thank you.